14th. The time is 7:33 a.m. We will go ahead and do the roll call. Ms. McDonald, would you please do the roll?
Mayor Slanka?
Here.
Mr. Richmond?
Here.
Ms. Zipsey?
Here.
Ms. Baguette?
Here.
Dr. Zollett?
Here.
Ms. Lawley?
Here.
Mr. Bonnell?
Here.
Ms. Miller?
Here. Thank you very much. And do we have any citizen comments today?
No. This might be a good time if we want to introduce our new board member. And her name is Tiffany Baggett. And I'll let you say anything you want to say to the board. And if the board wants to go around and kind of say your name and your background, it'd be neat. I think I told her all about you guys, but. All good things.
All
good
good, all
things.
good stuff. No, my name is Tiffany Baggett, and I'm really looking forward to working with all of you, so pretty excited.
Would you tell us a little bit about your background?
Well, I've been a state tested nursing assistant probably for about 26 years. I currently am the supervisor over housekeeping and laundry. I've been doing that for 2 years, so I kind of changed it up. But I've been working for Willow Knoll for 22 years, so, yeah. Were you? I was there. Yeah, so, that's about it for me.
And you're from Middletown?
I'm born and raised, yeah, a Mitty.
Wonderful. Any other questions for Ms. And is it Baggett?
It's Baggett,
Baggett.
yes.
Gotcha. Very well. We will do. And Tiffany's with an I, correct?
With an I, that's important.
I like to get that right.
Yeah.
Well, welcome to the board, and thank you so much for your time and service and volunteering.
Sure, thank you.
It's very important. Okay, so the next item we have on the agenda is the approval of the December 24 minutes. Do we have a motion to approve?
So moved.
Thank you. Do we have a second?
Second.
Has been properly moved and seconded. Is there any discussion about the minutes? Hearing none, we will proceed to vote. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Baguette?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller? Yes.
All right, the yeses have it, and the motion passes. Next on the agenda is to receive and file the financial report for December of 2024. Do we have a motion to approve, or to receive and file?
So moved.
Thank you. Is there a second?
Second.
It has been properly moved and seconded. Is there any discussion about the financial report?
Just wanting you to know, I heard you loud and clear. We need to understand this financial report. So we have, I have it on my desk. It's a long spreadsheet trying to explain all of the different areas of our expenses and our revenue, as well as, I think we're gonna do just maybe a small little synopsis PowerPoint with finance here, to answer any questions you may have. But we think that we should be able to, get something, we're going back and forth with finance, if you will, and get something that's clear. So for instance, when you see the numbers on the side, what our revenue and our expenses are, the basic stuff, and what the grants are, what encumbered means, and that kind of stuff. So sometimes Carla and I were trying to wonder why some things were in parentheses and not, so we were trying to back out numbers and back in numbers to see, but we're gonna put it on a spreadsheet for you, so we should have that by March.
For the year?
And for the, I mean, I'll have the spreadsheets on my desk now, but we're just fine tuning it. But as far as the presentation,
Okay.
I mean, you know, the ability to ask somebody in finance, well, what's this number and that number? So next month, February, the spreadsheet will be ready for you. And so be ready for questions in March with the finance person if you have any additional questions.
And that's for the year of 2024?
That's for the year of 2025. It's our projected
Oh,
budget.
okay.
It's our budget for our
Oh, okay.
projected budget.
Excellent.
Yeah, it's our
Very well.
projected budget for 2025.
Fiscal year 25,
Yes.
okay. Excellent.
And so once you get that spreadsheet, then, yeah, then just say, well, what does this mean? Well, what does that mean? We'll answer it, but then we'll have the opportunity for her to be here.
Well, thank
So.
you. Does anybody have any questions or discussion about the the December 24 month financial statement? It looks like we're doing well.
Yeah.
We reached our revenue goals,
Yes,
it exceeded them.
we exceeded, yes, we brought in more revenue that was budgeted, and we spent less that was budgeted. So
Mhm.
that's-
Yeah, that's
That's
in a nutshell,
usually
it's a
the
good
goal,
thing, yeah.
right? Yeah.
Okay, and, so let's see here if I have any, yeah, that's basically it, so, okay, so we have that motion and that second, do we have any more discussion on this? Hearing none, we will proceed to vote to receive and file the financial report for December. Ms. McDonald, please.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Baguette?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
Yes.
All right, the ayes have it, the motion passes. The next item on our agenda is our education presentation by Dr. Genowine.
Good morning, everyone.
Good morning.
So we're going to talk about norovirus today. It's been in the news quite a bit with some increased numbers. So I thought it was a good time to talk about it. So norovirus is actually called the Norwalk virus. Norovirus is the genus name, species is Norwalk. Norwalk is the only species of that genus. In 2002, which I didn't even know there was this entity, the International Committee on Taxonomy of Viruses decided to change it from the Norwalk virus, which of course was named after Norwalk, Ohio, where the first outbreak was described in 1968. Wasn't identified until 1972. In the 2000s, they were trying to get away from naming viruses after the location of the outbreak, particularly countries and poor areas that seem to have higher outbreaks of certain viruses. So they tried to get away from Norwalk and go to norovirus. By 2011, they realized that was kind of a mistake because in Asian countries, there's a family named Noro, and it was quite offensive to those people that this virus seemed to be named after them, so they tried to change it back to Norwalk, but it's just always stuck as norovirus ever since they tried to change it. So we're gonna call it norovirus, even though that's not technically correct, because that's what you're gonna hear in the news and any public health discussions about it is gonna refer to as norovirus. It is the most common cause of gastroenteritis in both the United States and the world, and it's the most common cause of foodborne illness. Approximately 50% of all foodborne illnesses are norovirus. It has unlike most other foodborne illnesses, quite a rapid onset. Most other foodborne illnesses take days to really kick in. Norovirus will kick in 12 to 48 hours. Luckily, it recovers about as quickly as its onset is, usually better in as quick as 1 day to 3 days. It's self-limiting. You really don't have any treatment for it other than staying hydrated and trying to decrease symptoms of the nausea and vomiting. The kind of the recurrent statement from physicians usually is let it run its course, kind of get up, flush all the virus out of you. Taking Imodium and drugs to slow down the diarrhea just can prolong the illness. Has a very low complication rate, so usually everybody gets well pretty quickly. Dehydration is your biggest risk factor, and particularly, again, as usual, very young and very old are more at risk of complications from the dehydration, but still most everybody gets over it pretty easily. It's a pretty miserable 1 to 3 days, but it at least is pretty quick. So the signs and symptoms are, of course, nausea, vomiting, non-bloody, watery diarrhea. Those two things are the big hallmarks. Pretty much, I won't get ahead of myself. Stomach pain, cramping, discomfort, fever, any of the typical viral symptoms of muscle aches, headaches, those kind of things. But the GI symptoms are the big hallmarks. And again, you gotta watch out for dehydration by trying your best to keep hydrated, even though, especially in the early stages, you're throwing up a good bit. Transmission is what's called fecal-oral. So, probably one of the biggest factors in spreading it is someone who has norovirus and either hasn't presented with symptoms yet or has gotten better, but they continue to shed virus for up to 2 weeks after they're even feeling better. They go back to work at their food establishment and aren't washing their hands well and are spreading it to all the food they touch. Typically, non-cooked food, so it's your salads, your fruit, things like that they're gonna handle, and then you eat them, and it's very contagious, so it doesn't take a lot of viral particles to get sick. Contaminated food and water, oysters, clams, uncooked shellfish from farm raised, in particular with contaminated water, or fields, fruits and vegetables that are sprayed with water that is already contaminated are also big factors. So always washing your food before you eat it. Contact surfaces, being around an area that someone else who's already ill has touched and contacted or put particles on. it can stay alive on hard surfaces for up to 6 weeks. So unlike flu and other viruses that die off pretty quickly if they're not in a person, this sticks around for quite a while. And it's estimated that you only need 20 viruses to make you sick. 1 tablespoon of emesis, I read in one location, said there's 15 million viruses in that 1 tablespoon of emesis. So, and you only need 20 of them to get sick. It's that contagious. And then you can have person to person. So you shake hands with that sick person, or you're close. Air transmission is the one I was not aware of. So there was a description of a restaurant in Canada, 128 patrons in the restaurant. 1 woman vomited down onto the floor. The staff quickly cleaned it up. 90% of everybody at her table got sick. 70% of the people at the next table over got sick. 25% of the people at the furthest table away in the restaurant got sick. 50% of the people in the restaurant at the time she threw up got sick. So that was just air transmission. Again, lots of viral particles that are transmitted out that you don't need very many. So if you're in a public place and somebody vomits, run.
Okay.
That definitely woke me up. I'm like, holy cow. I mean, that doesn't happen very often. It's just somewhere somebody vomits. But man, you think about schools and that, I mean, that's a big chunk of that's norovirus. So diagnosis really is based on symptoms. In today's world, we don't do a whole lot of testing. You come in, you've been exposed to somebody else who's either been positive already or just having similar symptoms. You look at the onset. PCR testing is available, but it's mostly done by health departments, public health, to try to see, is it norovirus and is it a quote-unquote outbreak. Prevention and management, as I said, there is no treatment for it. It's just symptomatic, trying to keep them hydrated, giving them medications for the nausea and the vomiting so they can stay better hydrated. There is no vaccine, no approved vaccine. There is a vaccine that's pretty close, but I couldn't find any data on how effective it was. And it's been kind of sitting in limbo since about 2020, so I'm assuming it's not a great effectiveness. Hand washing is big, but it's really not that good. So very little kills this thing. So it's very contagious and it's very hardy. Hand sanitizers that are alcohol-based do nothing for it. So washing your hands is about the best you can do, but they recommend up to 30 seconds instead of the standard 20. Bleach is your best bet in not for yourself, but in disinfecting the house or any work location that has had a suspected contamination. It's a pretty strong bleach solution even, and then isolating the individual who you think is sick and has it, that they're not around other people in the house or coming back to work too soon or those kind of things. Risk factors and common settings, again, clams and oysters, uncooked shellfish that come from farm-raised areas in particular. They're coming from the ocean, they're not nearly obviously the risk. Leafy greens and your fruits, you're always going to be a little cautious about anything that is uncooked, and that's kind of true of anything. Food handlers, again, are a big source of spreading it. You know, there were a lot of articles talking about how individuals who work in restaurants usually don't get sick days. They don't get paid. If they don't go to work, they don't get paid. So if they're questioning whether they're sick or just not feeling that well, they're oftentimes going to go in and work, or they get sick and they're 2 days later and they're feeling better, they're right back at work. They're still shedding virus for up to 2 weeks. So food handlers are a big one. Close quarters and spaces, so hospitals, schools, nursing homes, cruise ships. Cruise ships are the big one. You really hear about this one with is, again, you've got a limited number of employees on that ship. And if they're able to get out of bed, I think they're expected to be at their station working. So you get a lot of contamination. And again, it's a 1-week cruise typically, so those viruses are put on that handrail, that doorknob, those tongs, whatever, and it just goes week to week to week to week, and it's hard to kill. You disinfect it and clean it out. Genetics, there's actually a genetic mutation that occurs that makes some individuals much less susceptible. It puts them at, they have about a 20% risk of contracting the virus compared to normal individuals. So it is a pretty significant, but doesn't guarantee they won't get sick. So currently, we get about 38 million cases annually in the United States. That graph is a little busy, but kind of shows the gray mix of jumping lines there is 2011 through 2024, and shows how it typically lands November into February are your peak months and times. The blue is 2021 through 2024. Showed that it's not quite as tremendous other than the one peak late in April, but it kind of pushed a little later in the season. The red line is this season, 2024 going into up through December, going into 2025. So it's a little bit early and it's pretty pronounced, and we haven't hit that peak yet. So it's quite an ongoing situation this year. Again, to kind of put it in numbers, you can see bullet point number 3, the outbreaks aren't tremendous, but those are outbreaks. Outbreaks are anything more than 2 cases that seem to be linked to the same viral scenario or incident. So it's not enormous, but I couldn't find numbers on whether those were 4 people or 400, but clearly this season has been quite a doozy for norovirus. But we're kind of seeing that with COVID jumps, flu jumps, RSV jumps. So this is kind of a viral winter right now, but and winter is typical. So October through April for the northern hemisphere is the common time frame for it, and then it kind of flips and moves south for their winter through our summer months, and that is norovirus.
Thank you, Dr. Genowine. Do we have any questions or comments or discussion? I have a bunch of questions. Bunch of questions. So you said washing hands is not stellar, but it's the best we've got at this point.
Yes, it definitely, you're not killing the virus. It's not this virus does not have an envelope around it, which is what usually alcohol will destruct and kill the virus, and soap. This does not have that envelope, so it's more resistant to those types of features. But washing hands will get it off of your hands, so you then don't give it to yourself.
Okay. And then you mentioned washing fruits and vegetables, especially like the green leafies and things like that. Is there a particular method that you recommend for washing, or just the fact that it's water will take it off?
Water and soap, hydrogen peroxide if you really want to get aggressive.
And that's like a solution of like half and half water and the hydrogen peroxide? Or is
Hydrogen peroxide, there are actually ones you can buy that are food grade. I don't know that I know off the top of my hand remembering the concentration. The one product I found was only a 0.5% solution of hydrogen peroxide, so it was pretty low. Because standard hydrogen peroxide you buy for like your first aid stuff, it takes us about 3%. So it doesn't take a lot of concentration. The bleach, if you're doing your house, they recommend 1 cup of bleach to 1 gallon of water, which most of the time it's tablespoons of bleach to a gallon of water. So again, it's a pretty strong bleach solution to disinfect.
And that kills?
That does, both of those do kill the virus.
Both kill. That's wonderful. Okay. And then let's see here. Can't read my writing, which is always interesting. You mentioned the vomiting in the restaurant. So if someone's going to vomit, does it help to have it like in that like bucket to make it enclosed? Would that help not disseminate the airborne?
Oh, I would have to think anything that would contain it would
Contain
be
it,
ideal,
yeah.
yes.
So it just, okay.
Yeah.
I think the workers would appreciate that.
Yes.
Just.
I had, the report on that incident did not say about the employees, but I have to think those poor people who cleaned it up probably got sick as well.
Yeah. Also, you mentioned that the water to water our fields and crops.
Yeah.
Do you know if there's any research on treating water for the watering, like anything to break it up in the water itself?
I'm sure there is. I mean, our water treatment plants do something to it, but I don't know enough about that to say.
And then,
And I think again, there you're talking developing countries that are growing produce and using water straight from a river that can be contaminated upstream and
gotcha.
isn't being treated at all.
And then, I don't wanna get too graphic, but since it is fecal oral, just wondering if there are some things that we can also do to kind of prevent that. And I don't know if this would work in workspaces or in homes, but and I'm curious about like, would bidets help? And also when we're changing diapers for babies, is that an issue?
Oh, diapers are definitely an issue. If the baby has norovirus, yeah. But again, it comes down to
hygiene.
Yeah, I mean, it's washing hands afterwards, and again, it's aggressively washing hands, getting under the nails, getting the back of the hands. I mean, the virus is kinda everywhere on your hands after you change the diaper. Even if feces didn't smear all over your hands, that virus is airborne as you're moving things around and doing things to the diaper. So you have to aggressively wash your hand and then sterilize the surface that you change the diaper on, so the baby's not re-exposed, you're not re-exposed. Yeah, hygiene is the key to that.
With that bleach solution that you mentioned, and I guess gloves and maybe masking could help while you're changing diapers as well? Like, it sounds like that would help.
I would assume an N95 would help, yeah.
Okay.
N95
And some
does.
gloves.
Gloves would help, but again,
Think
you're gonna wanna
wear
wash
that
your
every
hands.
time you change a diaper?
Just
So,
mentioning
yeah,
it,
and
just mentioning
sometimes-
it.
Come on.
Putting
You
it
know,
out
there are
there.
definitely studies showing that gloves create problems in that it gives a false sense of
I'm
security,
going to
so then you
change
don't
the
go wash your
diaper.
hands, and you don't do this, and don't do that, so.
Could you say that again?
I guess at a daycare would be good.
Yeah, that's like at work, that might help.
If you're doing a lot of 'em.
Maybe not at home
Yeah.
necessarily.
Yeah.
But what did you just say about the false sense of security?
There are definitely studies showing that gloves can oftentimes worsen an issue because of the false sense of security that comes with, oh, I've got gloves on, so I'm not gonna catch it, but, so then I don't even wash my hands, I don't wash them as well, and you really contaminate yourself when people sometimes when they pull their gloves off, and then it's on their hands anyway, and then they don't go wash,
They don't know how to do, yeah, okay. Well,
washing hands, and disinfecting the surfaces are the best things.
all right, those are the questions I had.
I was gonna say, and I think it's really difficult, cause when you have any kind of diarrheal issues, it's constant, right? So you can be really good that first time, but after a while.
And you feel
and
terrible.
And you feel terrible.
You're vomiting, you're running with diarrhea, you just
Yeah.
wanna get back to bed and lay down, and.
Yeah. A
yeah.
lot of stuff
And
is not
and it'll
obvious.
stay alive on your bedding, your
Right,
sheets,
yeah.
your clothes, again, for days.
Weeks.
And then in washing those things even, they point out, again, it's very hardy, so you've gotta wash it on the high cycle, preferably with bleach, dry on the highest settings, I mean, heat, bleach, and soap, the longest cycle you can do, I mean, it is a tough.
The point
virus.
is, it's not gonna change anything.
No.
After all this, it is what it is, and,
You're gonna have your 1 to 3 days, and
And
try
just-
not to spread it to everybody else in your house.
do the best you
Go
can.
go lock yourself in your bedroom,
I was
and
gonna say, let's get a
don't
big-
come out till 2 weeks later.
Get a big spoonful the first time, just get it done.
Oh, yeah, it doesn't sound like you can build up an immunity to it either, you'll just keep getting it over your life.
There are 10 different groups under that species, 48 different subgroups.
Wow.
And you're resistant to the subgroup you got for about 6 to 12 months.
Okay,
Oh, that's cool.
it's a part of life, but it is good to know some of the things that you can do
Yeah.
to prevent or not spread. So thank you very much for that, because it is quite common.
Yeah, and again, it does come back to always wash your hands, wash your hands, wash your hands, and wash them well. Don't just do the quick and you're out, because that's not doing anything.
Yeah.
For most things, let alone norovirus.
Thank you very, very much. Good to have that on record. Thank you. Okay, any other questions or comments? All right, hearing none, we will go ahead and proceed on to new business. The first thing we have no travel authorizations, so we can go past that. We have the 2025 election of President Pro Tem.
This is the time that we select our pro temp again. So it's always the mayor as the president, and right now it is Mr. Bunnell. That is our pro temp. And in your packet, everybody should have received your roster, but it is open for the board to discuss. Who's next?
So, Mr. Bunnell, do you wish to be pro tem again, or do you want to open it up for anybody else? Does anybody else wish to be president pro tem? No? So,
No.
all right, so, I have a
I
mo-
don't know what your schedule looks like this year. You plan to be here every time?
Yeah, exactly. Yes, I do. But yes, so, is there a motion to, re-elect Jeff Bunnell for the president pro tem?
So moved.
Is there a second?
Second.
All right, been properly moved and seconded. Is there any discussion? Hearing none, we'll proceed to vote. Ms. McDonald, please call the roll.
Mr. Richmond?
Yes.
Ms. Zipsey?
Yes.
Ms. Beckett?
Yes.
Dr. Zollett?
Yes.
Ms. Lawley?
Yes.
Mr. Bonnell?
Yes.
Ms. Miller?
All right, the motion passes. Thank you very much for doing that again. So that roll again. So the next item on our agenda is the 2025 Board of Health Committee selection. So what we have, just to remind you, we had this in the packet as well, who's on which committee. We have the Finance Committee and we have the Personnel Committee. So is there any discussion about that? Does anybody want to switch committees? We have Amy Sibsey, Sally Cash, we need to have a replacement for her, and then Joseph Richmond. That's on finance. Personnel would be Dr. Zollett, Jeffrey Bonnell, Ruth Lawley, and Emily Miller. So would Tiffany be able, Ms. Baggett, be able to choose, or should she, whatever?
It's, in the past, they always kind of took the person that they were, serving, replacement, but it is up to anyone. I was telling, Ms. Baggett that Finance Committee could get together at any time to relook at the finances, and/or if we do a levy, and/or if budget became an issue where we were trying to be creative. And so it's more committees, so at any time you could call a meeting outside of this meeting, and personnel usually needs once or twice my evaluation for the personnel. And then again, if you ever wanted to meet for something, specific. So they're pretty, and, you know what, and, Ms. Baggett may be really good for this committee too, because she'll be the fresher eyes on the finances. So we can really make sure that we get it, really clear what we're looking at too, so.
Okay, do you have any opinion or for which one you'd like to serve on?
Either one you want me on, it's fine with me.
Hard to know.
All right.
Yeah.
Finance and personnel, basically that's about it, so, okay, well, thank you.
Okay.
So we don't have to make a motion for that, we just select, we just volunteer.
We would just place her on there, yeah.
Okay, so it looks like we will go ahead and place you on the Finance Committee,
Okay.
and I believe everything else will stay the same.
Everything is the same.
Okay, well, thank you. With that, are there any other questions or discussion about that? We'll proceed? Okay, we will proceed. And so the next is the 2025 Board of Health roster.
Again, look really close to make sure that everything is the same, correct. Anything that needs to be changed, numbers, make sure we have no typos on your information. Especially this time of year, we always have a group text. We could call you, Dr. Zollett, if we need to, but a group text if for some reason we are not in session. Like with this crazy weather. So we have never missed a board meeting in my 28 years, so that has been so cool. But we have to, Ohio Revised Code says we have to meet monthly, so we would just have to schedule another date. So just FYI, and I'll try to make sure I get it to you, like if the building was closed like it did that Monday, I'll try to get it to you as soon as possible. And just send back, got it, okay, or something, so I can make sure, because if not, I'll call you. And that also always serves as our call out too. We can use that to serve as our FEP, emergency preparedness call out. When we send a message out and you respond back, then we can say that we've tested the drill of our board too. So just take a look at this and just make sure it's all good. But that's it.
Can everybody take a moment just to ensure that your contact information is correct, including your email, phone number, name, spelling, address.
My email's missing the one.
Oh, I updated that, I wonder if
Yeah,
that was the,
yeah, that was
the
one.
one.
Yeah,
Okay,
Yeah.
okay,
yeah, here's the new one. You can take this one with you.
okay.
We
Thank
caught
you.
that one, yeah, thanks.
Phone numbers wrong.
His phone number's incorrect, okay.
Should be 2545.
Yep.
Any other corrections that you're seeing? If you do spot a correction, they could email you or text you, Ms. McDonald, if you see one later. Okay, any other questions or comments about the roster? All right, wonderful, we move on. So we've got the 2024 fourth quarter report.
Oh, just really quick,
Yes.
numbers, yes, the quarter report is in the packet. We are, I think everything's the same, except we're just not gonna repeat our meetings, right? So, yeah. And the quarter report is in there for last quarter, which was 2024, and you'll always see the last quarter for 2023 in there as well, for a comparison. That's it.
Any comments for the report? Any comments or questions on the report?
I have none.
Okay, we will move on. And then, the final, item under new business is name, address, phone, health history from form update. Okay, so, Health Commissioner would like to speak to that.
Yes, this is Ohio Department of Health, you can tell, form, we call it NAF, name, address, phone, and home. This begun in, for 9/11, when we started having the terrorism attacks and/or the anthrax. And remember, we're supposed to prophylax people with the anthrax, so that was the Cipro and the Doxy. So this form lets us know, because the board are first responders, in a case of emergency, you become first responder. We take care of our board first, amongst with the police, fire, et cetera. And it lets us know how many blank you need to stay safe. And so if we're giving out Doxy or Cipro, and so you list your household, that's in your household. And if it's children, you list them for their pounds, because children get different medication. And if anybody's allergic to any antibiotics, you put that on here. But it just helps us, if it's an emergency, we can automatically go to our board, drop off medication to you, and then you guys can wait to be called on to serve in any capacity. A really quick example would be, I think ODH wants us, correct me if I'm wrong, Chandra, to vaccinate or prophylax our population in 24 to 48 hours. And so you're supposed to have a plan how you're gonna do that. And so we have a plan how to do it, how to get medicine to people in a timely fashion before we open up a big point of dispensing where we give it out to the rest of the population. But we usually take care of, our helpers first, because all of us would be in gear and on site at the distribution points, and so.
But now you
that's
got
what
all
this
these
is.
people aren't gonna take it.
Well, then
They
they
got
can,
all that other nonsense.
I know, well, that's for those that want it.
Yeah.
For those that want.
Okay.
All right. Anything else?
Yeah, but and we try to update this every year, you guys, and so because we gain weight, lose weight, we have people like our adults, kids move in or move out, so our households may change or whatever, so we do this every year. If, excuse me?
I'll email them the PDF one.
Yeah, and she'll email the the
Yeah.
PDF form.
This is for the people.
Yeah, and then just, get it back to us. You can turn it back in the next board meeting or email it back to us, doesn't matter.
Let's go ahead and say that out loud so everybody can hear it. So this is for the board members, and then also she was talking about first responders. So that the first responder, because we are considered first responders on the board,
Mhm.
so we get this so that we can also help in a situation. Yeah. Okay, any other questions or comments? All right, we'll move on to reports. Health Commissioner.
And just really quick, I'm excited that Ruth Lawley is our point of contact for Walk with the Doc. So
Yes.
she's gonna get Dr. Zollett all
Oh.
over.
Yeah,
Yay!
listen, it's indoors this weekend.
Yeah.
What?
Oh, there you go. We're at the Y, downtown.
Why?
Why at the Y? Because it's cold out.
Come on, buck up, okay.
If you wanna walk outside, we will let you.
I have a great coat though, so that's different, so I
And we were
understand.
thinking safety too, right?
Yeah,
All the ice and-
yeah.
Well, and then February we'll be back outside at Atrium because we're doing something, a collaboration with them for Heart Health Month, so.
Okay,
Yeah.
so this month, January
So
18th,
January, this Saturday, 9 AM, downtown Y,
downtown Y, on the
Yeah.
track?
on the track.
Mhm.
Or you meet in the lobby?
We're gonna meet at the front desk.
Okay.
I'll probably be up at the track, but everybody can come in, sign in at the front desk. You do have to sign a waiver, for the Y.
Mm.
And then just head upstairs and we'll walk. We have a speaker from
I can't.
Premier Health talking about cervical cancer,
Mhm.
for about 5-10 minutes and then we'll walk. It's my understanding it's 15 laps equal 1 mile on that track.
Nice.
Typically, the, walk we do over at Rosa Park ends up being 1.5 miles, according to my watch. So, yeah, you walk for however long you want.
That's wonderful. And, you said February you're gonna be at the Atrium Y?
February we'll be at, not the Y, we're gonna be outside,
Outside of the Y?
outside at Atrium.
Oh, the
There's a
hospital.
trail at the hospital.
Oh, okay.
Yes.
And why is that?
They reached out and wanted to partner with us for.
Heart month.
Oh, that's
Yeah,
nice,
for-
okay.
Yeah, so, I'm still trying to coordinate a meeting to finalize all that stuff, and then we'll be back at Y in March.
Okay.
Back and forth, and then hopefully back outside April,
Yeah, that makes
Yeah.
sense, okay,
so.
wonderful.
And then a couple more things, a financial report made simple, as I spoke before, and you can take a look at that as we are starting to break down our things, but we're trying to get that together. And I have a speaking engagement for Unity Day, for MLK on the 20th at, Saban Hall, Liberty Township. This is they march and then they have a little speaker. Let's see, Primary Health Solutions, this is pretty exciting too. The 9th Avenue building that Primary Health Solutions has, they have a chiropractic doctor in there coming soon, opening up soon. I did a tour, and emergency dentistry, and I think it's gonna be kinda like pediatric dentistry too, where they can, put the kids to sleep or do whatever. So I took a tour of the building, it's beautiful. They're gonna do outside facade as well, and some landscaping, and so, hopefully we can maybe have him come in too and talk about all the services they have for the community as well. We have a new liaison for this ODH, replacing Wally Burden, and his name is Jason Meckenhoffer, I think, or something like that, Minchhoffer, Menchhoffer, Minchhoffer. But he's gonna come in and speak to us, and he's doing all Southwest Ohio, so we'll, get a meeting set up with him. Wally has been a great liaison, and, I already know Jason. Most retired health commissioners or whatever kinda go up to the state, so we know Jason already, but he seems like he's pretty cool too. But anything that locals need, they come and sit in our Southwest regions meetings, and he takes it back up to the state and communicates it, so it's a nice little bridge back and forth to the state. I will pass this around. Middletown Connect, is doing a survey again with, the ambassadors about code enforcement, and we're getting these flyers out here. It's really cool. These are like little snippets for you guys too, to look. What are code violations, how to address them or whatever. It's just a cute little flyer. Property maintenance and whatever, so I'll pass those little flyers around.
Do you know until when the survey is being taken?
I'm not sure. I have to see. That might be on there forever. Deanna just sent the email out with the link.
Is it, okay, so it's active now?
It's active now, and I think that survey, when I clicked on it, I didn't take it yet, it's just a few questions, and it says, what's your 3 top nuisance in your community? And so, you guys will get the flyer. Dr. Zawad pass a flyer to, you can keep one.
That's okay, I'm
Yeah.
not.
You're not gonna take
Sending
the survey?
anything to rub people.
Yeah. And so, but it's kinda cool, because that way, you know, we'll be a part of the process of, you know, cleaning up our neighborhoods or saying what happens on our streets. Sometimes they can't see inside our neighborhoods, and so it'll help that way. And last, it's a Cincinnati paper called Soapbox. We did an article and had, photographers come in, and this is something with economic development, and Clayton set these up, but they're gonna do articles on Middletown like 7 times, I think, or they have some agreement where they do something in this far-reaching area, yeah, so. They did a, article and interview with me and took pictures with Clayton and I, so I don't know, we'll have to, hopefully it comes out good or whatever, but it's called Soapbox, and the, reporter is Steve Augst, how do you, Angst, or Augst. Augst.
I know.
So anyway,
And
coming soon.
Coming soon,
Yeah,
okay.
coming soon, I'll let you know, I'll send it out to the board, or we'll have it in the packet as well. But I think that is it for this new year.
All right, any questions, comments for our health commissioner? I was curious, you mentioned surveys. Do we know how Middletown Connect is proceeding or progressing with the questions to the community about work and why community members are not working? I know that was still going on.
Yes, I think Deanna has a report on that too, so it's coming up. I do know that everybody, and tell me if you've received this or not, but Middletown Connect is doing all ambassador meetings together now. So they're all together, and they're for a month. They're Saturdays and Monday, and Saturdays and Monday every other week. So Saturdays may be better for some, Mondays may be better for some. You can come to all of them, but it's to keep all the ambassadors up to date on all the initiatives.
They're having
And
4 a
so-
month?
Yes, so they usually have, yeah, I think it's every other. They usually have twice a month, right? Thursdays and Mondays. Monday, Thursdays, and then it was another Saturday or something.
Well, that's because there were so many different pockets, but if
Yeah.
they're having all at once now, would they
Mhm.
just have 1 a month?
No.
Okay.
Because she said, because the reason why she said is that
Location.
some people are better with Saturdays,
Mhm.
and some people are
that's what I
better
meant.
with Mondays.
1 Saturday, 1 Monday.
Oh, yeah,
No?
and then, no.
Okay.
I think it's twice. I
Okay.
think it's every other week, but I'll double check.
I'll find
She's
that
gonna get
out.
it back, yeah.
Yeah, I'll find out.
She'll get the, invites out, cause I was wondering, is it all together or not? And she's trying to pull the neighborhoods all together, cause everybody is kinda doing the same thing, but they have their different nuances, and so.
As
to get
Middletown-
everything together.
Yes, as Middletown Connect grows and is able to cover all the neighborhoods of all of Middletown,
Mhm.
then that would make sense because we can all just meet together.
Yeah,
Okay.
and then, coming up, there is a HIP, Health Improvement Partner meeting coming up soon too. So, when I met with Deanna and the whole core group last Friday, all of these meetings were gonna get out. So we're meeting, the core group is meeting every Friday to make sure we get everything ready to, put out to the ambassadors. So to be continued, make sure you're getting those too, because remember at one time you weren't getting those
Correct, it was
meetings.
going
Yeah.
to, right, yeah.
Yeah,
Okay.
but I think that's it for me.
Any other questions for our health commissioner? Questions, comments? Okay, we'll continue with our medical director.
Reportable illnesses for December. Chlamydia, there were 20. Gonorrhea, 8. Pertussis, 8. Hepatitis C, 6. Hepatitis B, 1. HIV, 1. Legionella, 1. 2 Candida auris, 2 Campylobacter. Norovirus is not a reported illness, so those are never on our reports. Influenza was not very populous in December, relatively speaking, but anecdotally, I'm sure Chandra's gonna talk a little more, but since January started, at least in our office, we've seen quite a jump in influenza, but that's pretty much it. There is in your packet also the comparisons for Middletown for 2024 versus 2023. Particularly with the hepatitis, confirmations, our numbers are down. COVID, our numbers are down, of course. But it's kind of interesting when you kind of look at year-to-year differences in there, and that's in your packet as well. That's all I have.
I have a question. In the office, what are the signs and symptoms of that you're seeing with the influenza? Is it normal flu and the upper respiratory?
Upper
or is it-
respiratory, yeah.
that's it?
Fever,
I mean,
cough.
fever? I mean,
Yeah.
okay.
Mhm.
I was just wondering what the, okay.
Yeah, and it is nice that right now, this year, I think it's the first year that I'm aware of, you can send them to the pharmacy and get a swab that does A, B, and COVID all at once.
Mhm.
So it's pretty nice to do a home test, they don't have to come into the office, kind of expose other people, and then just by phone visits now, you can know when did the symptoms start, can we do anything treatment-wise, and that's been pretty handy to get diagnosed quick.
Wonderful, thank you very much.
There's no way to know, I mean, if you don't get that tested, you can't tell whether it's just a respiratory virus or the thing, or flu or whatever, cause.
Yeah, and everybody
I
wants
had
antibiotics,
it,
you know
but
it.
I don't think it was, I thought it was, respiratory. I mean, it was bringing stuff up and low-grade temp and stuff like that, but.
Yeah.
And it lasted for and it seems like everybody I talk to seems to have had it or.
Some
know
version,
somebody that
variation
has
of it, yeah, yeah.
Mhm.
But the ones I've seen, the flu ones, the true influenza ones, are notably longer. So instead of that kind of 4, 5, 6 days of kind of feeling crappy and coughing, they're pushing 2 weeks.
Although I got a flu shot, so I don't know if
Yeah,
that
I
doesn't.
did just recently read that it's not very effective this year
Oh,
at
good.
all.
Okay, so that's
Probably
good
one of the
of that.
weakest.
Maybe it was the flu.
Yeah, one of the weakest years for its value.
Okay.
Don't put that in the record.
All right, well, thank you, doctor. Any other questions or comments? The health director, medical director. Okay, wonderful. We'll move on to our director of nursing.
Okay, so, just as was already brought up was the NAP form. If you need a paper copy, today if you wanna fill it out super quick and leave it with me, that's fine. Like Amanda said, she'll, email out the PDF fillable document that you can send back in. Those don't go anywhere other than in a file in my office, for emergency reasons. So definitely appreciate, filling those out. Hope to never have to use them, but just in case. I've mentioned it, in the past, but it's quickly coming up. Our, regional, FEP chemical, response tabletop exercise is on February 4th. You may have seen the invitation, sent out, by Jackie, because her name carries a whole lot more value than mine does in this city. We're trying to get people to participate, and join us, on the 4th. It's a half day from 8 to 12:30. Registration starts at 8, the exercise starts at 8:30, and then we try to get everybody out by 12:30. It's gonna be very rapid moving. If you do decide you wanna come, and be a fly on the wall, we still want you to register. Not necessarily that, you know, you don't have to 100% be an active participation person to be there. You may just be curious as to what our preparedness programs do. And so this would be a good opportunity for that.
I have a question about that.
Sure.
Are you speaking, are you changing the subject?
No, go ahead.
Okay, so is this open to the public then?
No, it's an invitation only, event. It's ideally meant for our, so this is, we're focusing on certain, FEP, standards, for communication, access and functional needs partnerships, our, coordination of services, with our, partner agencies like EMA, other health departments, fire, police, things like that. So the primary participants are going to be health departments, EMA, fire, police, hospitals, and AFN partners that have also been invited, like schools and DD and agencies that would be a useful partner to reach out into the community to get messaging out on sheltering in place, who to, you know, where to respond to if you were exposed to, you know, this incident, things like that. So it's, no, not open to the public, but it is got a lot of our community partners involved.
And what does participation look like for anybody who wants to participate?
So it's a tabletop exercise, and there is a set of questions that will be pushed out in rapid succession, because we have a lot of things we have to cover in a very short amount of time. But it is kind of like this. It'll be a round table, and we'll target questions to EMA, we'll target questions to the hospital, and then we'll target questions to public health. And those pockets, those groups will then answer those questions. So it's very much a discussion. But it'll just be specific to those questions.
And afterwards, will we have like a summary for us?
Afterwards, there would be, so at the exercise afterwards, there's what we call a hot wash to kind of go over the goods, the bads, the ways we can improve, ways that we excelled, things like that. And then, of course, after that, even, there's another meeting that we'll have, and it's called for an AARIP, which is an After Action Report and Improvement Plan. So, and we have somebody in the corner kind of evaluating us, and saying, you hit the mark, you didn't hit the mark, these were great, could do better. So we would have to write this report, and you guys will get a copy of that report as a board. So you'll know exactly how we did.
That'll be included in one of our packets?
Yes.
Okay.
And I was gonna say, the board is welcome to come.
Yes.
And I emphasized yesterday at the staff meeting, the senior staff meeting, for people to attend if they have never been to a exercise before. Because this goes on all the time in the public health world and the EMA world, and police and fire should be doing this when you're exercising emergencies, because you don't wanna get to know people at the time of the emergency. You already want your partners at the table, and you want them to have some idea what you might be expecting out of them at the time. And so we do this often with different exercises, like this is a chemical
Mhm.
test, but we do radiation, we do flu, we did pandemics, with the flu, that's the reason why we were so ready and capable with COVID, and so we do it. So I told, we always have police and fire there, but anybody that wanted to kind of watch is from, what, 8:30 to 12 or?
Registration
12:30?
starts at 8, exercise will run through till 12, kind of the hot wash will be between 12 and 12:30, get everybody out by 12:30.
Yeah, I
So if you
think,
can't stay, it's
yeah.
okay too.
it's a hard day for senior staff
Right.
because we have a meeting, a council meeting that day.
Yeah.
It's kind of rough, but you
Right.
mentioned we have more, this is not local, correct? So we have
Yeah,
more
this is-
locally?
Oh,
Is
yeah.
it, this
This
one,
is a
yeah, is
Hamilton.
ESC, cause
Yeah.
we are kind of
Road trip, yeah.
jointly, because
Mhm.
Butler County, we share resources, countywide. The 3 health departments are doing it together in one location so that we can share EMA and share the countywide resources. But that being said, we have at least one exercise every fiscal year for the FEP. Depends on whether it's a full-scale exercise where we do a full setup of an event, a tabletop exercise, or a discussion based get-together kind of thing to run over a plan. There's always an exercise every year within our FEP deliverables. So, sometimes they're virtually where we could be here in the building, sometimes they're off-site. It just really depends on what's expected in the grant year. This was our deliverable for this grant year.
I think it's gonna be wonderful. I was, riding along with the fire department when we had the truck tip over that had,
Mhm.
I think it was it gravel? And I got to see our EMA
Mhm.
in action, like the whole thing. It was incredible. They are such a finely tuned machine and they service a lot of the country even. So,
Mhm.
it's a very impressive thing. If people can go, it is nice to step.
Mhm.
I would appreciate participation. I think it's, like I said, there is a lot planned into this short amount of time, but it will go super fast and it could be very eye-opening to what public health emergency
Yeah.
does on our level.
Yeah, and the injects are so cool because you wanna fail, in a sense, because you wanna start thinking about it, they'll say, well, who do you call? And it's like Ghostbusters, what's their number? I don't know. And then, so it makes you really start getting your plan tight, because they have all these fun little injects. And like she said, it comes quick. You barely have discussed the first problem before another one comes, oh, now we need 12 beds, and the hospital has played with us. We've had a lot of good fun.
Nice. All right.
Last thing I had to mention was our workforce grant is moving right along. We are still, the state just recently had a call with us. I know we've been mentioning the FAB additional funding of $50,000. The state is asking for a little bit of grace because of the holiday season to get out all of those final notices of award of that money. But I've had no indications that we won't get it. I think we're fine. We just are waiting on the final blessing once they go through all the paperwork. But we just submitted for our final quarter of 2024, because that runs October through December, so we submitted that this week, or this past Friday. So we're pretty much on schedule for what our financial plan is for the year.
Thank you very much. Any questions or comments? All right, seeing none, we will continue. Thank you very much. For Environmental Health Director.
Okay, for the month of December, we received 2 sets of plans. We approved one plan for a body art. We licensed La Rosa's, so they are open now at the new location. We have one change of ownership for a retail food establishment. We're continuing receiving payments for our septics. We have received about 340 out of 600 payments, and we're continuing receiving our septic business payments and T21, and we're waiting on a few body art renewals. All of those should have been in it by the end of December, so if they're not in, they'll have to pay a 25% late fee if they're not postmarked by December 31st. We're continuing with the seller training, which is the new web-based, environmental program that will be, the state is, a program that the state is, allowing us to use for free. So that is looking at a go-live date of May. So we're looking forward to that. So we're steadily going to having conference calls and trainings for the new web-based program. And other than that, I think that's all I have for this month.
All right, thank you. Any questions or comments? All right, thank you very much. Next item on our agenda, that concludes reports. Next item, our board member open discussion. Do we have anything anybody wants to bring up at this point? I know I wanted to say a couple things. I want to go back to the introductions, but first I want to just mention that Shalom is open. That's serving the homeless with alternate lodging of Middletown, Shalom. I think everybody here is familiar with it, but it is running from January 5th through March 2nd. And that's where the churches, I think it's every 2 weeks, switch locations, and anybody who needs housing for the evening can meet, I believe, at 4 p.m., between 4 and 5 p.m. at, is it First Methodist? Or First United Methodist Church on 120 South Broad Street. To get signed in, there's a dinner available, showering's available, talking and camaraderie, and then they are driven to the church around, I believe, 6. Where they can sleep, and then the next morning around 8, they are dropped back off at the church, I believe, in the morning. So that is available if anybody needs it. Anything else that anybody would like to mention? I did want to go back around and just do the introductions for Ms. Baggett. If we could do that, maybe start right here.
I'm Joe Richmond. I've been on the board for, I think it's my second year now. I remember actually. My background's in health and wellness, health promotion, and I'm an insurance broker. I do group benefits for 4 years.
I'm Jeff Bonnell. I'm a funeral director here in town.
I'm Ruth Lawley, currently now with Hospice Care of Middletown. Previously, I worked in addiction medicine. And we have some similar backgrounds. I did environmental service at the hospital and STNA, so yeah, I'm sure we could share some good stories. So welcome.
Thank you.
Hi, I'm Amy Sipsey. I'm also relatively new to the board, but I only work at facility here in town.
I'm Lynn Miller. I'm an infection preventionist for Atrium. I've been on the board a little over a year.
I'm Scott Zolla, retired doctor.
And full of personality.
Oh, yeah.
An opinion.
What?
An opinion.
Yeah, well, hey.
Not shy.
Keeps us awake, keeps us up. And you guys want to introduce
Yes,
yourself? Because she
please.
probably haven't, I know I introduced her to Carla, but.
Oh, I'm Carla Ely, Director of Environmental Health and Assistant Health Commissioner. I've been with the city for 26 years.
You don't look that old.
I'm Amanda McDonald. I am the Vital Statistics Registrar and Environmental Admin, and send out all the board stuff if you need anything.
I'm Paul Genowine, Medical Director for the City of Middletown, probably 15, 18 years. I'm also an intern at City of Town.
And I'm Mayor Slemka, Elizabeth Slemka. I was elected in November of 23, so started serving in 24 in January. Born and raised in Middletown. I've lived other places, but I love it here. My parents own Central Pastry Shop, so I grew up in the bakery. Beer is my mother, John's my father. But I love it here. I'm very happy to be able to serve as the president of this board. Very interested in what we do here, and that's why I'm so thrilled to have you on the board. So thank you very much again.
You're welcome.
What's happening?
We've met. I'm Chandra.
Yeah, we had a good talk.
Yeah, Director of Nursing. Been here for 4 years. Or no, this is my 5th year with the city. Been in public health for 25 years.
All right. Well, thank you, everybody, for taking the time to go around and to introduce yourselves. Really appreciate it. Anything else that you'd like to bring up under new business, or not new business, forgive me, open discussion? Anything at all? Okay. With that, then we will adjourn. The next meeting is on February 11th at 7:30 a.m. Thank you so much.
Thank you.